Welcome to the Lead Change podcast. I'm your host, Dr. Mary Mulcahy. I'm an orthopedic sports medicine surgeon with a huge interest in contributing to the growth and development of other leaders. On this podcast, we will share stories from many leaders in all medical specialties to understand the skills necessary to be an effective leader. We'll celebrate their success and hear about strategies to overcome hurdles. We will also highlight some of the unique challenges faced by women in medicine who are interested in pursuing leadership positions and the importance of mentorship, sponsorship, and allyship in achieving and being successful in those roles. Let's work together, build on shared experiences, learn from those before us, and use these lessons to propel us forward in our career. Let's lead change. Welcome, everyone, to the Lead Change podcast. I am so excited to have my very good friend and ELAM colleague with me here today, Dr. Laura Ngwenya, to have you on the podcast. Dr. Ngwenya is an MD, PhD. She's the director of the Neurotrauma Center at the University of Cincinnati Gardner Neuroscience Institute and an associate professor in the Department of Neurosurgery and Neurology and Rehabilitative Medicine. She's a board-certified neurosurgeon-scientist with a clinical and research focus on traumatic brain injury. Dr. Ngwenya earned her MD PhD from Boston University School of Medicine. She then underwent training in neurological surgery at The Ohio State University and completed a neurotrauma fellowship at the University of California, San Francisco, prior to joining the faculty at the University of Cincinnati. Dr. Ngwenya is an associate professor and vice chair of research. She has mentored over 35 trainees at varying career stages and is the inaugural UC CAST Neurotrauma Fellowship Director. She is active in national neurotrauma organizations, serving on the executive committee of the AANS-CNS section of the Neurotrauma and Critical Care as the awards chair and member at large, and as the past treasurer and current vice president-elect for the National Neurotrauma Society. Laura and I are both participating in the Executive Leadership in Academic Medicine program this year. We actually first met in June when we were placed in the same group for our summer case-based project, which was very interesting. It involved creating a new budget for a fictitious health sciences university that was in financial distress. So the project was actually really unique in that it required a lot of close collaboration, all of which was done completely virtually and with several incredible leaders from institutions around the country who had never met or worked together. We learned a ton in this process. I think Laura will attest to that too. And we all connected immediately when we finally had the chance to meet in person in September. I have really, really enjoyed working with and getting to know Laura over the past several months. I can't wait to have her share some of her interest and insight from her many leadership roles. Laura, welcome to the podcast.
Thank you so much for having me. Yeah, I'm excited.
All right, let's dive in. So before we sort of get into some of the specific leadership roles, Laura, tell us a little bit about your clinical practice and really highlight some of your areas of expertise.
Yeah, so as you mentioned, my focus is traumatic brain injury. So what that means is patients that come in that have had a car accident or a fall or any other sort of trauma, when they have a brain injury, whether it requires surgery or not, I'm generally the first one that is part of the care team taking care of them. So, but I also do a lot of research as well, and some of that involves clinical trials related to traumatic brain injury patients, and some of that is actually my basic science laboratory that studies traumatic brain injury. So, what my clinical practice looks like currently is that every day I come in, I round, I check on all the patients that are in the hospital that have had traumatic brain injury, ones that have had surgery, the ones that have not had surgery. And then on Mondays, I have some additional sort of research time. On Tuesdays, I'm in clinic all day. And then on Wednesdays is my operative elective surgery day. On Thursdays, I have some administrative time for all those leadership roles that you mentioned. I have some dedicated time to do some administrative duties. And then on Friday, I have a little bit more research time. But oftentimes, my schedule does get disrupted because any trauma that comes in, the residents are calling me first to take care of that when those patients arrive.
Yeah, right. You have, of course, no idea when the traumas are going to come in. And so
Correct.
that's a really important point. And I love too how you went over, kind of gave an overview of your week, just so everyone listening can kind of get an understanding. Like in general, yes, this is your schedule, but we all know as physicians and surgeons, as scientists, especially, as a physician taking care of trauma-related injuries, the schedule can be quite unpredictable. And so I think it is important to understand that. We mentioned in the intro that you currently serve as vice chair for research in the Department of Neurosurgery at the University of Cincinnati. So, explain to us what that role entails and really what are some of your main responsibilities in that position?
Yeah, that's a great question. So it's a vice chair role. So some of it means, working closely with the chair, being part of the sort of executive branch, if you will say, of the department. And specifically for research, what I'm tasked with is building our research infrastructure. So that means increasing and making sure that we're performing well in the clinical trials that we participate in throughout all of the subspecialties within neurosurgery. It also means supporting those of the faculty members that do basic science research. So there's myself, but there's also two PhD faculty within the department that are not clinicians who do research. So it also involves supporting them and their needs and making sure they have the resources that they need to be successful. And recently, what I've been tasked with is really looking at the budget and the numbers. All those things we learned in, in summer ELA
Yeah.
I've definitely learned a lot. It's budget season at this current time, so there's a lot of, especially with changes going on and with NIH and expected funding, there's a lot of looking at budgets and trying to make sure that we can continue with the research mission for the department.
Yeah, it's so important. I know there are a lot of challenges around the country, but I love too how you brought up right in your role, you're doing some of your own research, you're supporting the other neurosurgeons, but also your PhD faculty too. And although some of the needs overlap, there are some differences too. And so it's really important in your position to understand what are their unique needs, what resources do they need. And so that's critical to support the overall, as you said, the overall sort of research mission of the department. And as you stepped into that position, were there specific, I guess, what were your specific goals and how have you been able to move towards achieving those?
Yeah, so one of the goals, I kind of had two main goals. One was to increase our department's clinical trials. We started with a fairly small clinical research team in terms of the clinical research professionals that we have that are part of our team. And I really think that, within neurosurgery, there's still so much we don't know. And being able to be part of these clinical trials that are going on in all the different subspecialties is really important. So one of my focuses has been on increasing our involvement in clinical trials and making sure that we're enrolling patients and that we're able to be efficient and effective in the clinical trials that we're a part of. And then the other main goal was really trying to get the other neurosurgeons that maybe don't have a PhD but want to be doing research, trying to figure out a way to support them, right? So some of that is about education and making sure that they understand the sort of tools and things that they need in order to do research. So part of it has been doing things like making sure we have a statistician that can help for projects that are ongoing throughout the department, but also looking at what are some of the other resources that are needed when you have someone that's a busy surgeon that wants to also do some research. Like, how do you support that? How do you find time? How do you find resources? And how do you make it such that the department sees the value in that surgeon taking a little bit of time to do research? So those have really been the two main things that I've been focusing on.
So it's amazing that you are helping to facilitate that, creating opportunities for your faculty, but there has to be a huge infrastructure, right? Like there are a lot of pieces that go into that, recruiting patients, consenting them, like following up, at their different time points. That level of research is fantastic. So congratulations to you and your team for being involved in those studies. Because it has huge implications for patient care downstream.
Yeah, yeah.
So, in addition to being vice chair, you're also the director of the UC Gardner Neuroscience Institute for TBI Learning Health System. So, what do you do in that role? And really, what are some of your main leadership responsibilities?
Yeah. So, as the director of the Neurotrauma Center, part of what that means is really looking at the treatment of neurotrauma patients, and that includes traumatic brain injury, but also spinal cord injury, and treating them throughout their whole continuum of care. So, even though, yes, I'm a surgeon and, I think about things from a surgical perspective, it also means taking care of those patients that don't need to have surgery. So, patients with a quote unquote, concussion, right? Thinking about, how they come into our hospital system, how they're being taken care of once they're in the hospital. So some of that includes writing guidelines and working with our trauma colleagues to make sure that we're following evidence-based practices for how we take care of the patients. But then also making sure that when they leave our hospital, they have appropriate follow-up appointments. If they're going to a rehabilitation center, making sure that we still have those connections so that we're part of that continuum of care. So part of what we're doing with the learning health system, it's a way of thinking about how do we get better patient outcomes, but how do we do that not from just the perspective of what a researcher or a clinician might think. How do we get better outcomes from the perspective of patients, from the perspective of community? So, what it really entails is bringing together patients, caregivers, community partners, in addition to therapists and physicians and researchers, getting everybody together to really think about how can we do things better? What does a good outcome look like? What are the different things we can try? So it's really about trying different interventions to see if we can have better outcomes, things that don't necessarily, it's not a randomized controlled trial, it's not the big clinical trials that we were talking about before, but it's really important work that can have really great impact for patients.
Yeah, that is so great to hear that you guys have that very comprehensive system and all these different, kind of a multidisciplinary approach, which is so important. And you made a really good point, too, that yes, you're a neurosurgeon, but you still are very much involved in taking care of patients who don't need surgery or haven't had surgery. And it's the same for us in orthopedics. And I think that that's really important for people to understand, too, that it's really critical that we have a good understanding of who doesn't need surgery, who needs surgery, what are the appropriate indications, and then what defines a good outcome on sort of both ends of the spectrum, and who can we get involved to help us get there, right? To sort of get that best outcome for the patient. And I love that you're bringing in the perspective of all these different groups, including patients. Right. That's really fantastic. You're the principal investigator for your translational neurotrauma laboratory. And I wonder if you can share a little bit about what the goal of your collective research is.
Yeah, sure. So the research that I do in my laboratory is very closely linked to what I do clinically. So as I mentioned, my focus is on traumatic brain injury. And one of the things that we found over the years when we do some of our clinical trials is that when I take a patient to the operating room for a traumatic brain injury, one of the things that we do is we can leave behind a subdural electrode strip. So it allows us, when the patient's in the ICU, for us to detect things like seizures. What we've also realized is that oftentimes these patients are having this other abnormal brain electrical activity called a cortical spreading depolarization. So some of the research that we've done and that we've been leading at University of Cincinnati have shown that patients that have these cortical spreading depolarizations, when you look at their outcomes 6 months later, they're doing worse. So what I'm trying to look at in my laboratory is to figure out why and how are these cortical spreading depolarizations contributing to worse outcomes. So I have a rodent model of traumatic brain injury. And we also induce these spreading depolarizations. And then that allows us to do things like look at behavioral and cognitive tasks, look at things down the line, such as, does having a cortical spreading depolarization contribute to development of epilepsy months later? Also allows us to look at the brain tissue and look at histological things and things that may be changing within the brain tissue that can give us a clue as to how this electrical activity is causing these bad outcomes. So that's the short version of what my lab does.
It's so interesting that there is, a direct connection, of course, to the patients that you treat, the surgeries that you're doing, and the research that you then are involved in your lab. And so you see that direct correlation, the translation, and the downstream implications. And so that's fantastic when those two things can merge so nicely. And it's great that you have the infrastructure and the group committed to doing those studies with you. So you have also served in some very important leadership roles in the National Neurotrauma Society, including treasurer, vice president elect, and soon to be vice president. So, congratulations. That is amazing. Before we dive into some of the specific leadership roles, I wonder, can you share with everyone listening a little bit more about what the Neurotrauma Society is and what are some of the main areas of focus of that organization?
Yeah, sure. So the National Neurotrauma Society is a nonprofit organization that is a group of individuals that essentially get together to discuss science and advance the mission of learning more and understanding more about neurotrauma. And again, that includes traumatic brain injury and spinal cord injury. It started as sort of a spinoff of Society for Neuroscience, which is sort of the big neuroscience meeting that a lot of people know about. That meeting, that organization is huge, and they have a meeting, once a year of about usually somewhere near 30,000 individuals. The National Neurotrauma Society is a bit smaller because it's a focus group of individuals that are interested in neurotrauma and advancing knowledge in neurotrauma. It's somewhere around, we have our meetings, it's somewhere around 1,000 people or so. This group has a lot of different things that it does. Some of it includes advocacy. So when we have meetings in different cities, there's a big advocacy arm that's involving local communities and making sure people understand about traumatic brain injury and recovery, and making sure we're giving a voice to patients that have had experience with traumatic brain injury and spinal cord injury. And there's also a really big mentoring role that this society does. There's a huge part of the society that's called Team, which has to do with training, education, and mentoring. And it's really helping sort of the new generation learn and understand more about neurotrauma and giving them the mentorship that they need so that they can be successful researchers, clinicians in this space.
So that's so interesting because I personally knew nothing about the Neurotrauma Society. And for you, during your term in the presidential line, are there certain initiatives or goals that you have, things that you would like to implement? And, we'd love to hear a little bit about that.
Yeah, one of the things that I've been working on and really hoping to implement during my time on the executive committee is really helping to keep and strengthen the connection between the National Neurotrauma Society and our organized neurosurgery groups. So within neurosurgery, we have what's called the Joint Section for Neurotrauma and Critical Care. And I'm on the executive committee of that group as well. And we have our sort of section meeting is usually linked with the National Neurotrauma Society. One of the things that has happened over the years is that sometimes the neurosurgeons that are part of the organized neurosurgery and neurotrauma don't always see the value in attending the National Neurotrauma Society meeting. So one of the things that I'm trying to do is really strengthen that bond to help people understand that it's hard to move forward in the field of neurotrauma unless you're really able to look at that holistic approach, right? So it's not just looking at the clinical side. You also need to look at the research side and really getting everybody to talk together. I mean, that's how you come up with great ideas, right? I mean, if the researchers stay completely isolated from what's happening in the clinical world, then we won't make any progress. Part of my goal is to really help strengthen the connections between these two groups and really help build the society. And
Yeah, that is so important. And we see that in orthopedics too, in various ways. I mean, we have subspecialty societies, so sports medicine and shoulder and elbow and whatnot. And then we have a big overarching organization, our American Academy of Orthopedic Surgeons. So very, very similar, where each, the subspecialties have their own societies, but yet we still want to stay connected under the big umbrella of the AAOS. So very, very, very similar. And I agree with you, so important. And especially as you were touching on sort of the clinical and scientific aspect of these problems, like having both sides, both parties together to discuss is so critical to actually coming up with good ideas, to being effective, to moving things forward, because, each side may not be thinking about something that the other group would be thinking about. And so when you share those discussions, it just is that much more productive. So I love that you're doing that and that you're so active in both groups. And in your time thus far in the executive committee, really for both of these societies, but what are some of the main leadership lessons that you've taken away? And how have these lessons helped you in other aspects of your career?
yeah, I think one of the main things is really understanding where people are coming from, right? I mean, when you're in these sort of leadership roles, and when you're in these sort of national societies, people have very different backgrounds, very different perspectives, very different sort of goals of why they're part of the group, right? So I've learned that it's really important to kind of listen to all the individuals to see what people are bringing to the table, why they're there, how they want to contribute, and really think about how the group of sort of very different individuals, right? Like, what's the common thread that's going to get everybody to work together to be productive? There's a lot of times, you can have meetings, and if everybody's got their own agenda and people aren't collaborating, then just nothing happens, right? It's just a whole bunch of meetings, and you just sit in meetings all the time, and no progress is made. So I feel like one of the things I've learned is the importance of really listening to everybody's voice, seeing where everybody's on the same page, seeing is sort of the common ground that everybody agrees, like, let's work on this together, just so that there's something's productive happening, and it's not just a meeting just for the sake of a meeting.
Yeah, right. We don't none of us need meetings just for the sake
Yeah,
of
I have
meetings. So
enough
that
meetings.
that is so important. It's such a great point that that's fantastic that from a leadership perspective, really focusing on connecting with everybody and trying to understand what their goals are, what their needs are, and what collective goal or mission you can all move forward towards. As you said, I mean, that is the way to make for a productive meeting and a productive group and to ultimately achieve something together. And as you alluded to, this common thread or a motivating factor for a group, I think we have talked several times on this podcast about sort of your individual or your personal why. What is it, what is it that drives us, what motivates us? And I wonder for you, Laura, what is that? What is your main driving force in all that you do, in your research, in your mentoring, in your involvement in your national societies? Like, what is it that drives you?
Yeah, that's a great question. So some of it is me being a neurosurgeon scientist. So I think it's really important the ability to be both a surgeon and a researcher. And I am very passionate about the care and treatment of traumatic brain injury patients. And I think some of that is because it's the patients that are sometimes not noticed, right? So these are patients that, it could be a homeless person or the senator, right? They're coming in for a car accident. It doesn't matter, right? And oftentimes what you see is that it kind of levels the playing field when somebody comes in as a trauma. And I really appreciate being able to make sure that I'm giving excellent care to anyone that comes to the door with, and oftentimes I don't even know whether they're the homeless person or the senator, right? I just don't know. And I think it's really important to advance that mission and make sure that patients that are sometimes not noticed in society are getting the best care. And then related to the neurosurgeon scientist piece, I think it's also important to be able to mentor and train and make sure there's infrastructure in place for people that want to advance the field in a way similar to what I'm doing. So a lot of the things that I do, the different leadership roles I've agreed to take, it all kind of wraps around kind of the same thing. It's like, providing excellent care to patients that may have otherwise not been noticed, right? And then also supporting the mission of being a surgeon scientist. So a lot of the different roles that I take, it's usually, it's kind of going off as little spokes off of that same sort of central core. And that's probably, I guess, my why. I guess it's maybe a long answer, but
No, but I think that's great because having an understanding as you do very, very, very clearly helps guide you, right? And everything else that you do helps you make decisions, helps, motivate you and sort of guide the trajectory through your career. And you can say like, yes, I want to be involved in this neurotrauma society, or I want to be doing this research because it aligns directly with where my passion is. There are some stark differences between neurosurgery and orthopedics, but there are some similarities too, right? So
yeah,
so
yeah.
neurosurgery, very similar to orthopedics, is behind other medical fields in terms of gender, racial, and ethnic diversity. I mean, I think we know this, we own this. What do you see as some of the main barriers to recruiting more women into neurosurgery? And what can you and we and all of us as leaders in the field help to do to address this?
Yeah, it's a great question. I will say that, in the past, 10, 15, 20 years, I think a lot of strides have been made. I think just prior to me starting residency training, there actually was a big push in neurosurgery to try to make things a little bit more equitable, to encourage more women to join neurosurgery. So there was a lot of stuff that was done on an organized neurosurgery level to really encourage that. A lot of what has been shown and what seems to be the most effective is that a lot of it is mentorship. And it doesn't necessarily have to be that you see somebody that looks like you everywhere. That's part of it. But some of it is just having someone that is going to be supportive of you taking that position, right? When I speak to some individuals that are older than me, a generation or so ahead of me, there's a number of female physicians that have told me that they wanted to do neurosurgery, and when they went to talk to somebody about it, they were told not to do it, or that they couldn't do it, or that they shouldn't do it, and it was just discouraged just because they were female. And I feel like that's changing, where now if a female wants to do neurosurgery, most of the time she'll come across someone that will say, "Yeah, let's help you get in," as opposed to, "No, don't do it." Right? And I think that attitude, that mentorship, I think is key. And then obviously as you get more women within the field, right? Then you do see more women around. And then you also get that, "Oh, I see someone that looks like me. It looks like I can do this," right? But I think it really starts with having a supportive, someone that's supportive and saying, "Yes, you can do this."
Yeah.
So that's my thought.
Yeah, no, I think that that's so true, and I think there are a lot of similarities between neurosurgery and orthopedics in terms of the changes we've seen over the past, I don't know, 10, 15 years. Like, when I was a resident, we never even talked about this. We never, like, not never. And now, in practice, there are sort of talks at major meetings. Probably you have this at your neurosurgery meetings too, where there's various talks related to diversity and various topics, but it's recognized, I think, even at the highest levels of leadership, that being intentional, supporting diverse groups like male, female, racial, ethnic diversity, all of that is really, really critical to providing excellent patient care too, right? Bottom line
Yeah.
is, like, we
Yeah.
want to have neurosurgeons and orthopedic surgeons that represent the patients that we're taking care of.
Exactly.
And like you said too, yeah, we take care of such a wide variety of patients, and from various ethnicity, various cultures, like, and various socioeconomic status, and so we want to just be able to be in tune with that. And so definitely I've seen a huge change too. And when we see on match day now, when I see the pictures over the past few years with all the programs posting, like, that, it's a huge, huge change in the diversity of the programs in every aspect. And I'm sure that's what you guys are seeing with the neurosurgery match too. And so I love
Yeah,
seeing
we
that
are.
every year. So, as I mentioned too in the introduction, you are participating in ELAM this year. We're sharing this time together. And I'm so
Yeah.
glad that we've had the opportunity to really work closely together as part of this program. But what are some of the main things you've taken away from the program so far?
One of the things, so I've done a lot. One of the things they encourage us to do in ELAM, as you know, are to do these leadership interviews and these meeting observations. So, meeting with leaders throughout the academic health center, observing kind of what happens in meetings. And one of the things that I've really have treasured is I really have used that ELAM card, and I've met with a lot of people and learned a
Yeah.
lot. I pretty much had an interview with almost everybody in our C-suite. I managed to observe a lot of meetings that otherwise I wouldn't have had a seat at the table because I wanted to learn. And by being part of ELAM, it gave me an opportunity to say, "Hey, like, there's a specific thing I want to learn, and I could learn from observing this meeting. Do you mind if I sit in?" So that's been great. It's allowed me to have a bigger and better understanding of how an academic health system works, especially some of the budgeting things that I hadn't really thought about before. Talking to some of the C-suite people, talking to the CEO and the CFO about how the hospital's finances are, right? Like, it's really interesting perspective that I just did not have before. So I think what some of the things that I'm learning the most really come from this opportunity and the encouragement from ELAM to go talk to all of the leaders throughout the institution.
Yeah, I agree with you. That has been fantastic. And you learn so much. And then they tell you too, like, oh, you should consider, like, talking to this person or that person, or
Hmm.
you learn about
Hmm.
some new program or initiative or whatnot. And so that has been a tremendous experience. I agree with you completely. And as many alums have told us, so alumni of the program have told them, they continue to sort of pull this card. Well, I did ELAM like 5 years ago or whatever. So I think it's something certainly that we should all continue to take advantage of too as we move forward in our career. And as part of ELAM too, one of the kind of big parts of the program is that we all work on an institutional action project. And it's supposed to be something that you are personally very interested in and that also will help your institution. So can you share with all of us a little bit about what you're doing for your project?
Yeah, sure. So it's related a bit to the learning health system that I mentioned for traumatic brain injuries. And one of the things is that it almost sounds fluffy, right? It's like, oh, we're gonna work together and have better outcomes for patients, right? So My institutional action project is how do we take this fluffy, nice sounding stuff and actually have things that matter to the academic medical center to make sure that it's going to be sustainable. So right now we have some philanthropic support that supports the things that we do. But I want to make sure that the hospital sees the value in the things that we're doing so that we can continue to do this work. So it's really broken into two parts. One part is how do we build sustainability through research, right? So yes, we're doing all of these things, but how do we actually take some of the work we're doing and have some scholarly productivity? Are there actually grants that we could get related to the work that we're doing that will help on sort of the academic on the university side for them to see, oh, this is productive. This group, the way they're working together and getting everybody together, there's some academic productivity coming out of this, right? And then the other side, which I've been actually spending a bit more time on, is the potential financial benefits to the hospital system. So if we're saying, for instance, something like, okay, we want to have, we're going to do an intervention where we're going to talk to patients and caregivers and, make sure they understand what things they need to do to help them get back to work, right? Well, in doing that, can we actually reduce our 30-day readmissions to the hospital, right? Can we, like things like that, right? So how do we take the work that we're doing and link it to the metrics that the hospital is using to then, determine, how they're getting paid and, what their stars are and their, US News and World Report rankings, all of that kind of stuff, right? So how do we take this kind of fluffy, nice, sounding stuff and actually like make it something that has sort of a real outcome that the hospital system cares about from the hospital side and also from the academic side.
Yeah, that's huge. That's huge. And so it obviously directly aligns with your goals, your mission, but also you tie in ways in which the medical center and the hospital are going to benefit. And that in turn, as you know, well aware, and maybe some listening, that when you do that, it makes it that much more likely that number one, you're going to have the support, both sort of like
Exactly.
moral sort of mental support and the financial support, like the resources. So if everybody sees a way in which you can sort of collectively benefit, then it's that much more likely to be successful. So really, really fantastic approach. And the publications, the scholarly work, right? That supports promotion of faculty. And then the medical center benefits by having more people as associate or professors.
Mhm,
And then
mhm.
obviously the financial side from the hospital. So that is great. I can't wait to hear more about how all of that comes together.
Yeah.
Throughout your career, you've worked with a lot of different leaders within and outside of your institution. Can you share a little bit about some lessons you've learned from leaders that you admire, that you really respect, and what you think makes them good leaders?
Yeah. Probably the leader that I admire the most is Jeff Manley. So he actually was my fellowship director when I did my neurotrauma fellowship at UCSF. He also leads up a lot of the clinical trials that are happening in traumatic brain injury across the country. So he's one of the big leaders in the field, and he has just a really interesting story. He's an individual that initially had dropped out of high school and was working, and someone came across someone that realized that he was really smart and encouraged him to go to school. He ended up getting an MD PhD, doing neurosurgery residency at UCSF, and then soon after became faculty and is still faculty at UCSF. And but what's so striking about him is that he is able to bring together people from all different disciplines, from all walks of life, and everybody loves him. And I can't figure out what like his secret sauce is, to be honest. Like I don't know if it's because he comes from just kind of a humble, you know, upbringing and kind of went through so much to get to where he is, but he is able to lead and bring people together in a way that I've like literally never seen anybody else do. We have for these national traumatic brain injury clinical trials. I mean, you have neurosurgeons, neurologists, physical rehab doctors, people that are experts in their field, but they all are agreeing to come together and work together for a common thing, right? Without people having the egos you would expect that they would have. Like he somehow is able to bring everybody down to like, let's all do this together. And everybody listens to him. And I haven't figured out why. And so I'm still trying to like figure out, like, if you were to ask me what is his leadership style, I'm like, I don't know. Like, I mean, it's probably like, I think he's like a transformative leader, but like how he's able to do that, I still haven't figured it out. But he's probably the most inspiring leader that I've come across. Like it's just truly phenomenal.
Yeah, well, and that's amazing when you are inspired by someone else, right? Then you are really motivated to contribute to moving sort of shared initiatives and goals forward. So that's fantastic. His secret sauce, I'm definitely going to use that from now on. But related to the secret sauce, another way to look at this, what is his secret sauce? But for you, Laura, like, what do you think, what would you define as your superpower, like your own secret sauce? Like, what is it for you that is your biggest strength and really contributes to the success that you've had in your career?
Oh, that's a good question. I mean, and it's hard you know, it's hard to say, right? Because that's implying that like I'm successful and like, there's something that contributed. It's like, I mean, I don't know. I think, some of it is just my own ability to sort of really keep my focus in terms of what things are important. So kind of that question you were asking me earlier about, my internal why, and that's kept me aligned in terms of making sure I wasn't agreeing to do things that were not aligned with my why, right? So all the things that I'm doing are things that I really want to be doing. I think that's part of it from an internal perspective. I think externally, in terms of how I lead others, I really do try to listen and not be somebody that's leading from sort of a dictatorship sort of perspective. Like I really try to listen to other perspectives, and I like people to kind of collaborate and come together for ideas. I think a lot of times maybe it's effective as a leadership style for me, just because it's surprising, because as a surgeon, people don't expect that I'm going to listen to other people
That is very true.
and get them to collaborate, right? So I think maybe I'm effective because they're like, why is this surgeon like actually listening to me, right? So maybe that's why it's been effective. I'm not sure. It's like the element of surprise.
That is so true. Definitely people do not expect surgeons to listen. I would love to round out our discussion, which has been so much fun, with a few questions that I like to ask everyone. So, first, this podcast is called Lead Change. What does lead change mean to you?
I think, for me, and I feel like in some ways leading and leadership is also kind of mentorship and teaching others. So when I hear, lead change, what I think it means is informing other people or mentoring people to affect change in the way that they do things, which maybe is not how you intended it. But I think just because I come about things, I have a lot of mentees just, through my laboratory and then residents, and mentoring is very important to me. And I'm always thinking about training others. So I think of like leading as like, as is almost like a mentoring. So I'm thinking about it that way.
Yeah, I love that approach. I think that's just really critical and very appropriate for all that you do. And there's no particular intention. I love to just hear how different people interpret that. And then, I wonder if you've read any leadership books that have been particularly impactful for you or influential to you in some way.
Read a lot. I will also say sometimes I read like kind of the Cliff Note versions of leadership books on different
That's
apps and
efficient. I
such.
love that.
And back before I found some of these Cliff Note apps, I used to watch a lot of TED Talks, and there's kind of two that have always stuck with me. And one of them I think is affiliated with a book. The other one might not be affiliated with the book, but one of them, and I'm going to forget who the authors were, but one of them was related to power posing. And I'm not sure if you're familiar with the term, but essentially it's that if you put yourself in a different sort of position. So like if you do like a Wonder Woman pose, right? That you're going to actually feel better. You're going to present yourself better and things like that. There's some science behind it. There's some people that don't believe the science. But what I found was important about that is that there's some degree of sort of owning what your position is and being confident in what you do, right? So, I first watched that TED Talk when I took my very first leadership position, and I was like, oh my gosh, what am I doing taking a leadership position? I don't even know I don't know, like, what am I, director of what? Like, what? Like, oh my God. Like, so I was kind of freaking out a little bit. And that has been something that's just really helped me like recognize the importance of having confidence in what you know, what you can do, and making sure that you're outwardly showing that confidence. The other one is related to the why, right? So the kind of like what is your why? And I think I want to say I probably have the book somewhere, but it's a really it might be called Getting to Why, but it's a really famous. It was a TED Talk, but it's also a pretty famous book. But that talks a lot about, again, like what the central core is that makes you want to do what you're doing, but also makes other people want to be part of what you're doing, right? The importance of really honing in on what the why is, what the value is, what the importance is, and what it is you're doing. And so I'd say those are probably my books, where they're
Yeah.
kind of TED
Yeah. No,
Talks.
but
And
I love that. So many things about
I'm
what you
not
just
sure if I've read
mentioned.
the whole book.
But I didn't even know there were Cliff Note versions. That's fantastic. But I imagine for the second point, or the second book in TED Talk, probably Start With Why by Simon Sinek.
Yes, that's it. That's the
Yeah,
one I'm talking about.
fantastic.
Yep.
I love that book so much. It's probably come up like 10 times on this podcast. I love that book. And it's me bringing it up like 9 times. So I'm glad you brought it up for the 10th time. That is excellent. And I think it's so true for like highlighting the importance of your why. And you talked about, the leader that you respect so much, and that sort of core mission and being inspiring and getting buy-in. And so that is critical. And then the point you made too about kind of your pose, how you carry yourself. I tell students, residents, everyone that I mentor too, it's like carry yourself with confidence. Right? That's exactly it. Just like present yourself in a confident manner, and it is amazing where that gets you. Being prepared and all of those things kind of going together. But that's fantastic. And just highlighting too the benefit of a lot of TED Talks that are out there. Right, great way to learn about different leadership aspects too. So thank you so much for bringing that up. And the last question I like to ask is, do you have any favorite quotes?
I don't really have any favorite quotes, to be honest. Probably because I only
That's okay.
read the Cliff Notes versions of books.
That's great. Oh my goodness. Anyway, you made me laugh so much. So Laura, thank you very much for being on the podcast. I have absolutely loved this conversation, and I've laughed more than I have definitely like this week. It's hilarious. Thank you so much. I appreciate you sharing some of the experience and the insight you've gained by serving in these various leadership roles. And I know everyone listening is going to be really inspired, motivated, and equipped with a lot of tools to be a very effective leader. So I look forward to continuing to work with you through the next several months of ELAM and beyond. And thank you again. Thanks so much for being here, and thanks for all that you do.
Yeah, this was great. Thank you so much for inviting me, and this has been a lot of fun. Thanks.
Yeah, my pleasure. All right. Take care.
All right.